Good afternoon, and thank you for joining us today. My name is Mike Whitmer. I'm Vice President of NCMIC's Chiropractic Insurance Programs, and welcome to today's webinar. Before we get started, I have a few notes I'd like to share with you. We're using the webinars to explore a variety of topics affecting how you practice. If you have ideas you would like us to address on a webinar, please enter them in the questions chat feature on your GoToWebinar menu. All attendees are in listen-only mode. If you would like to ask our guest a question, you can enter that in the questions feature on your GoToWebinar menu. We'll address those issues at the end of the program as time allows. Our monthly webinars are broadcast live, but the recordings will be available in the resources section of ncmic.com. All registered attendees will receive an email with access to the recorded webinar following the webinar. Our next webinar is scheduled for Thursday, May 20th at 2 p.m. Central Time. We'll be talking with attorney Ken Skaz, who will be discussing electronic health records and sharing his perspective as an attorney who has defended chiropractors for malpractice. I hope you'll be able to join us. Today's webinar is about sports chiropractic, and I'm really excited to have with us Dr. Kelley Humphries for this discussion. Dr. Humphries is a member of the United States Olympic and Paralympic Committee's National Governing Body Council. She also serves as community ambassador for the USOPC's Council on Racial and Social Justice, and as a member of the Council on Racial and Social Justice's core team as the National Governing Body representative. She's a certified athletic safety coordinator at the U.S. Center for Safe Sport and serves on the organization's Athletes with Disabilities Advisory Group and Climate Survey Task Force. She has a lengthy CV of specialty certifications and accomplishments in the sports world, and she's an athlete herself, having played college basketball at Texas Women's University. Her experience spans from an assistant basketball coach, an adapted physical educator, to team doctor for world championship, Olympic and Paralympic teams. She is executive director of Paralympic operations at Logan University. Dr. Humphries, thanks for joining us.
Thank you so much for having me.
So did I get all that right? Your resume and CV is extensive, so I hope I got everything accurate on that.
And sounds great. Thank you.
Right.
Thank you for the introduction. I do appreciate it.
Let's dive in then. So if a doctor is interested in sports chiropractic, what steps can they take?
That's probably the most asked question I think that I get. And the best way I can answer it is define what that means to you. I think the rabbit hole that we as a profession fall in is that we pigeonhole what sport is and we pigeonhole what an athlete is. If you want to work with a team, define that, and then make sure that you're speaking to the gatekeeper at that team. Depending on the team, that could be the athletic trainer, or it could be the person that's in a similar position as I am, right? The person that is the executive director. Understand the environment that you want to work in, and that's probably your best bet. Once you know the environment that you want to work in, and you understand the group or the individual that you'd like to work in, take time to learn that environment. Don't go in there gangbusters, think you know everything and that you can be everything. Take some time, learn, figure out where it is where you can actually be the niche in that system, and then go from there. It definitely helps to have additional certifications so that you can be the ultimate translator in that environment. I think that that's the place where our profession can serve the best. We are the ultimate translator across multiple healthcare professions, but having some additional certifications to kind of help guide that, to kind of help you understand how other professions speak amongst themselves, especially in the sports world, will definitely benefit you.
So if I could just do a follow-up to that, are there any certifications that, you know, should be top of the list? Or is it more find one that is an area that is of interest to you and pursue that?
Right. My opinion, and this is definitely my opinion,
Sure.
so please take it as that, is find the certification that's going to speak to the population that you want to work with. So, for example, let's just take the Olympic and Paralympic movement. One of the requirements for a chiropractor to even make an Olympic or Paralympic team as a medical provider is you have to have your CCSP. That's a requirement. There's no way around it. That's what you have to do. But that doesn't mean that you can't be a sports chiropractor in another environment. There are other situations, particularly at the collegiate level, where a strength and conditioning certification is going to take you much further than your
Mhm.
CCSP ever will take you. Your emergency medical practitioner certification will take you much further than your CCSP ever will. If you're looking at doing things outside of, Team USA, looking at an international sports chiropractic certification will take you further than your CCSP ever will. So it goes back to my initial answer. Know the environment that you want to work in, define it to
Sure.
yourself, research it, and then move forward accordingly.
Yeah. And then just one more follow-up. We have some students on line today with us. And is there anything, and you work at Logan, so you interact with students. Is there anything that students can do now before they graduate to kind of prepare them for this world? Are those designations available to them? How does that work for a student?
For students, I think the biggest cautionary word that I would give them is that please understand that being a sports chiropractor is not always going to the Super Bowl or going to the Olympics or going to the Paralympics or holding up, the Stanley Cup. That's not that's not everything that's involved in being a sports chiropractor. There's so much more to it than that. Those are the really fun parts. Those are the high parts. Those are the things that live with you for the rest of your life. But the day-to-day happenings of a sports chiropractor, make sure you understand that before you decide that this is what you want to do. It's long nights, it's crazy hours, it's being away from home a lot. It's devoting yourself to a cause, right?
Yeah.
It's devoting yourself to an athlete, it's devoting yourself to a team, it's understanding your role in that ecosystem, it's respecting the coaches and who they are and what they are and doing what they need you to do to make sure that the athlete gets what it needs, because at the end of the day in this business it is not about you, it's about the athlete.
Okay. Yeah. Yeah, and what you said about it's not all the glory moments. There, as with most things, the glory comes after a lot of hard work. So, and it sounds
Right.
like that's definitely
And
the case here.
yeah, and students find a doctor in your area that is saying that they're a sports chiropractor and take a look at what they're doing and then find
Mhm.
another one and find another one and find
Sure.
another one and then figure out, who's doing it the way that you would like to do it and go from there.
Okay, great. Let's move on. As a chiropractor, you treat the whole person, not just an injury, not just a symptom. Athletes are not just a piece of equipment to be used, they're people. So how do you approach the treatment of the athlete as a person?
Um, First and foremost, that statement is what you have to keep at the forefront of your mind.
Mm.
They are people, right? They are
Yeah.
people who are just as organic and as raw as you are. They have passions, they have desires, they've been hurt, they've seen joy, they've had life experiences, and they bring all of that to the table. Literally, when they are on your table, they bring all of that to the table. You have to also understand that you're taking care of them for in various snapshots. It's either an immediate one where they're trying to get back onto the field of play, or maybe it's a more long term. Maybe you're dealing with an athlete that's trying to come back after an injury, or maybe you're dealing with an athlete that's perfectly fine, that's just trying to get that edge, right? They're so close to that peak, right? They're so close to that point of, optimal performance, and they just need a practitioner to kind of get them to that next level. So when you approach an athlete, Understand that no matter how they define themselves as an athlete, they view themselves as an athlete first and foremost, and take that into
Mhm.
consideration. Make sure that you're taking the time when you do your initial encounter with them, when you do your initial intake with them, that you build that rapport, because for that individual, if they view themselves as an athlete, their body, right, is their most prized possession. And you don't want to mess that up. And they need to make sure that they can trust you, that them allowing themselves to put their body in your hands, take time to build that rapport. And then finally, understand that just like you have bad days, they have bad days. And as you're going through your treatment process with them, make sure that they are always an active participant in that, right? Athletes need to know that you understand how they feel. And the only way that they know that you understand how they feel is if you allow them to effectively communicate that to you.
Okay, thank you very much. So a segment of sports chiropractic practice is working with disabled athletes and this is an area you have lots of experience with. How can chiropractors work with athletes with disabilities?
View them as an athlete.
Sure.
I know that that sounds a little crazy, but they're not a disabled person. They are a person, and they are an athlete, and they are not. Um, the best way I know how to put it is don't view them as an anomaly. Don't view them as it's a miracle that you can do what you do. No, I'm athletic and I'm an athlete, and treat me as such. But also, with that being said, make sure that you take the time to learn about their disability and to learn how their disability affects them, not only on the field of play, but also in day-to-day life, right? The other thing is immerse yourself in that culture. Just you decided to be a chiropractor because it's a culture, right? It's
Mhm.
something that spoke to you, right? The way that we go about treating people, the way that we see the body, the way that we assess the musculoskeletal system, and so on and so forth. If you are interested in working with individuals with disabilities, learn about that community and don't be afraid of that community. Um, Once you get an understanding at that point, I think that you're able to take your practice, and especially athletes with disabilities, it's such an untapped market. It's crazy. They need us. They really do. The
Yeah.
things that we can do and how we can service them if we just took the time to get to know their community and allow them to see us in their community and what we can do for them. I think that it could really open up some doors and really affect some really positive change, not only within our profession, but within the disability community as well.
Okay. All right. Before we go on to the next question, I have some photos that you provided that I'd like to share. They're really cool photos, and this is from a powerlifting event your team was involved with, I believe. So if you could just, as I go through these, if
Yeah.
you want to just talk a little bit about what we're looking at and what the event was.
Sure. So this was actually from the World Para Powerlifting World Cup in Manchester, United Kingdom. We sent our team that qualified for this event to compete in the middle of COVID. So, you know, it was very, very interesting. Our coaches, our high performance manager did a great job on ground with our athletes. What you're seeing right now, this is our athlete, Antonio Martin. He is our heavyweight. So he lifts in the 107 plus kilo category. And this is giving a picture of him getting ready for one of his attempts. As you can tell, the sport of para powerlifting, it's the bench press. And I think right now that is, I think he opened up at 200 or a little over 222 kilos. So
Wow.
that's 202, 22 kilograms on the bar. And one of our coaches in training is strapping his legs down. That's how they level the field of play. And that's him getting ready for one of his attempts. So
All
um,
right.
Mr. Martin actually he has an incomplete spinal cord injury.
Oh,
That's his
okay.
disability. This is another one of our athletes. It was our very first international competition. That's Kelley Ann. Um, she did great. She transitioned from being a junior in the sport to a senior in the sport. She ended up placing fourth at the competition, and
Wow.
she actually has spina bifida. So that's her doing her thing in the 86 plus kilo category on the women's side.
Awesome. One more.
And that is Jake Schromm. Jacob is actually on track to make the games this year. He is on pathway to actually qualify for a spot at the Paralympic Games. He placed third in Manchester, and that is just a great picture.
It is.
He's
Yeah.
actually ranked number 6 in the world right now.
Oh,
So
really?
yeah, Jake has put in some time and put in some work, and he's dedicated himself to the program, and he has dedicated himself to listening to our high performance staff and our coaches. And it paid off in this
Yeah.
event, such that he's in striking distance. Jake is actually an above the knee amputee. I think
Okay.
it's hip involvement as well. So that's him showing off his third place medal in Manchester. That picture makes me
Wow.
happy.
That's it. Me too. Me too. And I don't know the athletes. And when I was going through those pictures, they all made me happy. It just looks like a great, wonderful event. So thank you.
Yeah, it was awesome.
Whenever we're talking about anything around chiropractic care, I like to highlight risk management issues. When working with athletes, many times doctors are in training facilities or they're at an actual event. How does the sports chiropractor address keeping clinical records? Is that important in this environment?
Yeah, it is. It's very important. And that's actually a great question. So when I do my personal medical, or when I send a medical person with our team, like we did for Manchester, they actually have records that they have to keep. It's required. It's a requirement for us. The reason for that is because there's a continuum of care. There's a liability, and it goes back to what I was talking about when you're talking about treating an athlete, whether the athlete has a disability or doesn't have a disability. That athlete needs to know that you have their best interest at hand, and you documenting what you're doing for them and communicating that to them so that they can go back and they can tell their at-home practitioner, because you're part of an ecosystem when you start dealing with athletes.
Hmm.
That's where this documentation comes in, and that's why it's so important. If you're just out there adjusting like gangbusters and not documenting it, and then that athlete needs to go back to their home practitioner, they can't, they are going to tell the home practitioner what they perceived that you did, right?
Right.
So now you're not only doing the athlete a disservice because they can't get the same treatment from their home care practitioner, you're actually kind of, diminishing what you've done as a practitioner. Because all an athlete knows is that I heard a snap, crackle, pop. So they cracked something and it was okay. That's not all you did. You did so much more in that treatment session, right? You affected a joint in a way that makes it function at a higher level. You affected that athlete's neurology. You did stuff, right?
Mhm.
Your documentation helps support that. So if for
Sure.
nothing else, do it for that. The way that we do it is we allow for the paper note, but then it's transferred into a secure EHR that we have. And when I travel with other teams, it's a very similar situation. And it's on ground, it's live. We have it to where we've got it on a touchpad. I can go do, 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 and then I can go back and fill in my notes the way that I need. The same thing with our practitioners that travel with our team. So it's vital. It's
Yeah.
vital.
Yeah.
Absolutely vital.
From a risk management standpoint, I mean, our listeners who know me and have heard me speak, I always say, that records are your front line of defense for a malpractice defense, which is true. However, what you said is really important. You need to know what you're doing so that you know this athlete, so you know what's been done, what hasn't been done. It's in the best interest of the athlete to keep those records so that goes with them. Very important.
Right.
All right, let's go on. Sticking with the risk management theme, what about consent? Athletes come in all ages, abilities, and physical condition. Is it important to get consent for chiropractic treatment in a training or event setting?
Yeah, it is. And again, it goes back to you're treating an athlete. They have an ability or they don't have. whether they have a disability or they don't have a disability. And I know that I keep saying this, but it's really, really important. That athlete is trusting you with their most prized possession, and that's their body, right? You need to make sure that that trust runs deep, and consent is the very first part of that. The other thing is that you have to ensure that you're doing due diligence by the organization that you're serving. So if you're working with, you know, an Olympic team or a Paralympic team, or you're working with a local high school team, so on and so forth, that organization should care enough about their athletes to ensure that proper consent is being obtained, whether it's an initial blanket waiver, which is basically what we do with our organization. We inform the athletes of the medical provider that's coming. They sign a liability waiver, which does the informed consent, so on and so forth. So there's a blanket consent that we have, but then our medical practitioner is always, if an athlete comes to them with an issue, they're trained to say, so are you okay with me taking a look?
Mm-hmm.
And that, just that right there goes such a long way, not only from that rapport that I was talking about earlier, but also for you as a practitioner. It protects you, it covers
Right.
you know that you're allowed to touch that person. We have consent, whether it's a training session or it's an event session. You obtain consent. The paperwork that we send our medical providers with actually has a little checkbox at the top. So we have it to where when the athlete first comes, they kind of do the checkbox signature type thing for a consent for us. And then that's kept along with their subsequent visits that they come and see us with.
Okay.
So it's a one-time thing on ours. But however your organization sets it up, however you think is the best way to obtain the consent, please do it. It's important on so many levels, if nothing
Yeah,
other than to build that trust with the athlete.
absolutely. All right, thank you. Okay, so along the lines of consent, what if the athletes a doctor is working with are involved in K through 12 scholastic sports? So we're dealing with minor athletes. How do you obtain consent from those minor athletes?
That goes back to that blanket consent, and to be 100% honest with you, that falls back on the organization,
Okay.
right? So my advice, again, this is my opinion. There might be people out there that have done it other ways. If you think that you want to be involved in kind of the K through 12 athletic population, please do it through a school or through a youth organization, or something like that. Don't just show up with your table and kind of take it upon yourself to kind of treat the athletes. Go through that organization, or if it's an event, please go through the local organizing committee that's putting on that event. Don't take that risk.
Mhm.
Don't do that to yourself. Don't do that to yourself. Because what many people don't understand is that those organizations, whether it's the high school or whether it's the local organizing committee for a youth sport, they have to obtain waivers and consent for participation. It's real easy to just tack on your consent with that, right? And then in your documentation specific for that, you can add a subsection for parents to sign off. But if it's already covered in the blanket consent form,
Mhm.
you're good. Don't put yourself in that position. It's not a good position to be put in.
Right, right. I think the point about, make sure you work through the organizing entity, is really important. You don't want to be the
And
go rogue, and you want to do it within the
right.
construct that they have in place.
And in reference to our profession, it helps with our visibility, right? So you're not the lone wolf.
Right.
And I think that sometimes we feel as if we have to operate in that fashion. You don't have to be the lone wolf. You can be a part of the greater movement and be just as visible if you were the lone wolf, right? And
Yeah.
your reach goes so much further. You reach so many more people, and you're connected in so many other ways if you go through the organization rather than trying to, as my nephew would say, it creep in the back door, right? Um, so just don't bring that on yourself. Just
Yeah. Okay. All right. Um, what boundaries issues do doctors need to keep in mind when interacting with athletes outside of a clinical setting?
It goes back to understanding what your role is in that athlete's ecosystem, right? In that athlete's community or in the sports ecosystem as a whole. Um, Meaning, as I stated earlier, don't go in there thinking that you can be everything to that athlete. You might have the skill set. I am confident as a chiropractor, you have the skill set. I'm confident in that, but no question. But just because you have that skill set doesn't mean that that's the way you need to operate in that particular instance. The beauty about having the skill set is that you can adapt to whatever it is you need to adapt to. Figure out where you're needed and fill that need and stay in that lane. Because what ends up happening is that the athlete sees that you are consistent in who you are and in what you are, which means that more times than not, they trust you more than anybody. And they will provide opportunities for you to be able to facilitate much needed conversations that they need to have with other members of their community. Outside of the clinical setting, it's great to see them, and so on and so forth, but understand that you play that role in their life, and stay in that role, and don't step outside of that role to the extent that you're stepping on another member of the team's toes. The other really important thing to understand is that, especially if you're working with professional athletes, they're people, guys. They're people.
Yeah.
They really are people. So please don't act like they owe you something. I know that sounds kind of harsh, but
Hmm.
respect them as people.
Absolutely.
And that's really the best that I can. I think that's the best way I can articulate it.
Yeah.
The strongest bonds that I've built with the athletes that I've treated throughout my career have always been the ones where I played a very specific role in their athletic life. And because I stayed in that role and I showed that I was willing to be the cross communicator with the other individuals in their athletic life, I became their most trusted
Hmm.
ally. And that's powerful as a clinician. It's a great responsibility, but you can't do that if you're kind of stepping outside of things and
Right.
stepping on toes, for lack of, or
Right.
treating them as if they owe you something.
Yeah. Yeah. Okay. Thank you. Good thoughts. Um, And actually, I'm going to just go ahead and go right to our questions from our listeners, because we've gotten several and some really, really good questions. So I'd like to dig into those a little bit, if that's okay. So one question from a student: where can we get the international chiropractic certification? Are there any resources that you can give for international sports chiropractic?
Yeah, FIX, FICX, the Federation of International Chiropractic Sports. I think that's what it is. It's
I
kind of in
think
a
it is
different
too. Yep.
language. I
Hmm.
think there's a day in there. Pardon me, I don't, I'm not sure exactly the official language that the Federation works in, but that's the organization that I got my international sports chiropractic certification from. So I believe their website is fics.org. You can go on there and you can learn all about their organization and the certification that they provide. So
Okay.
that's the resource that I would tap into for the
Great.
international sports chiropractic one.
Great. Um, so how necessary is the CCSP when working with college teams and programs, not sideline emergency work? So I think
It's a
that
really
what they may be getting at there is more in a training capacity and that sort of thing. So how necessary is that CCSP?
Um, in my experiences, and again, my experiences are my experiences, they are not the
Absolutely.
experience of others. So I just want to make sure that I say that. The CCSP does not hold a lot of weight in the collegiate setting, and it's because professionals in the collegiate setting have no idea what that means. Because that certification is very specific to the chiropractic profession, and even more specific to the chiropractic profession in the United States.
Okay.
So,
Got it.
and that's why it hasn't translated well over other healthcare professions, because of the specificity of it.
Hmm.
So in my experiences, again, they're my experiences, and the conversations that I have with collegiate sports. I have actually worked with collegiate athletes and been given that opportunity because I have my CSCS and my EMTP, not because I have my CCSP. They have no idea what my CCSP is. They have no idea what my ICCSP is, but they know what my CSCS is and they know what my EMTP is.
Gotcha. Okay, so we actually had a follow-up question submitted. I take the CCSP exam in May. Any advice on studying?
Yeah. So if I'm not sure what your prep's been. So if you were enrolled in a master's course and they provided curriculum specifically for the CCSP, or if you've taken it post-grad, like if you're a doctor and you're taking it post-grad, rest assured that your basic knowledge will get you and carry you through the test. Just make sure that you know how it applies specifically into a sports setting. If you've taken the master's course, just go through your notes for your rehab classes. Those are really big ones. Look at your athletic injuries courses that you might have taken. And then if you've actually take the curriculum components, make sure that you kind of understand those particular subsets for your upper extremities, lower extremities, so on and so forth. I think that our education in general, the education that you've been afforded to as you went through chiropractic school, prepares you very well for the CCSP. It's just the specific application in the sports world that I'm finding trips students up. I can't speak for field doctors, but kind of trips students up. So just kind of pay special attention to that, and go back and take a look at your emergency medicine notes as well. I'm pretty sure you had an emergency medical course, or you took that part of the postgraduate courses, to just make sure that you understand basic emergency medicine principles, because those are important when you're working in the sports realm.
Okay, great. All right. When working with athletes that have different abilities, each person has their own range of abilities. Knowing that no disability is the same as another disability, how do you prepare yourself when working with the individual athletes? Is there a story about an experience you have that would share something that you've learned?
I have a lot of stories. I'm not sure if I'm going to answer your question, maybe in the way that you wanted me to answer your question, whoever posed the question. But I think that the biggest story that I have to share is unknowingly being disrespectful to somebody who had a disability. So there's a thing called, there's a certain etiquette that you should follow. And I automatically assumed that an individual was incapable of transferring from their mobility device to the table. And I didn't know it at the time, but I offended them
Mm.
more than anything in the world. Uh,
That's a
for
hard
me,
place to
that's,
build trust from.
yeah. Uh, so if I had to answer your question honestly and truthfully, learn etiquette when it comes to dealing with individuals with disability. Make sure that you're not using degrading words like wheelchair bound. Nobody's bound to a wheelchair. They can get in and out of it anytime that they want, right? They're not bound to it.
Mhm.
So that's my first piece of advice. If I'm thinking correctly, probably what you're asking a little bit more specifically is, how do you prepare to treat somebody with a very specific disability when you're bombarded with a different disability every day? Look at the sport that you're working with and understand the disability that is prevalent in that sport. That's a really good place to start. If you're dealing with the Paralympic side, you might want to take a look at the eligible impairments. If you go onto the International Paralympic website, the IPC website, they talk about classification, and classification is where you can find the eligible impairments that athletes have to have in order to qualify to compete in a Paralympic sport. Those eligible impairments will give you an idea of the type of disabilities that you would encounter per the sport that you're working with. perfect example, let's just use our sport of USA para powerlifting. You have to have some type of lower limb impairment. You have to have some loss of function in your lower limb. So that means that there's a limb deficiency, there's weakness in the muscles, so on and so forth. So when you think about those impairments that are involved in Paralympic style powerlifting, you can start to predict what type of disabilities you're going to encounter. Somebody with a low level complete spinal cord injury, a lower limb amputee, an individual with spina bifida, right? And then when you think about the sport in general, it's a strength-based sport. It's the bench. So our guys have to have a certain physique. The more you learn about that, you kind of look into that sport, thinking about what those athletes look like, you can further begin to deduce what type of athlete will be able to participate in that sport, which will give you an idea of the type of disabilities you're going to encounter, which will allow you to do some background work.
Sure.
I really do hope that answered your question, whoever posed it. I know that it might not have, the first part might not have been exactly what you were expecting, but I hope that the second part was able to answer exactly what you were looking for.
Great, thank you. A couple more really good questions coming in. Are you keeping electronic health records or printing notes for the patient to take?
No, that's a good question. That's a phenomenal question. We do not give our notes to the patients. We don't. However, what we are able to do is we are able to provide them should the athlete need to go back and speak with their primary care provider, right? So it's just like if you were in your clinic, it's a request of records situation. And the really beautiful thing for us is that it's just a matter of shooting it over because we've already got it all documented. We never print them and give them directly to the athlete unless it is formally requested by the athlete, or we're doing a formal referral to a specialist, to their primary provider, anything like that. So yeah, that's a really good question, and the answer is no.
Okay. All right. We've got one more about the CCSP, if you don't mind.
Sure.
The question is, do you still recommend the CCSP if I already have my EMTP?
Depends on your goals, right?
Okay. Yeah.
What's your goal? Do you want to work? Do you want to be able to have no barriers when it comes to working with an Olympic or Paralympic team and or athlete? If the answer to that question is yes, then right now the standards for a chiropractor is for you to get your CCSP. You will not be allowed to travel with a team to a games. And so when I say games, I mean a Pan American Games, a Paralympic Games, an Olympic Games, Pan American Games, unless you meet the standards set forth by the United States Olympic and Paralympic Committee when it comes to chiropractors in their medical delegation. You have to have your CCSP. Now, does that mean that you are completely excluded from working with athletes that participate on the Paralympic side or the Olympic side? No, because each one of the governing bodies kind of manage that, but it will stop at the governing bodies. And if the governing bodies want you to travel with them to the big show, which is the games, you have to follow those standards. So if that's your end game, right? And it's all about your end game. That's why in the beginning I said define what sports chiropractic looks like to you. If that's your end game, get your CCSP. If that's not your end game, right? If your end game is the NFL, right? Look, there are chiropractors in the NFL who don't have their CCSP. They have other certifications, right? That work for them in that regard. There are chiropractors in the NFL that do have their CCSP. It just depends on the environment and what your end game is.
Sure. I think it's great advice, define your goals and then go from there. So good advice. All right, we've got time for one more, and I've saved the one that I'm probably looking forward to hearing your response to the most. Do you have a favorite experience that you can share where you were able to help an athlete reach one of their achievements?
Yeah. Had an athlete that Had an athlete that was at the point of realizing that their career was over. They were, and they were struggling with it. Um, and we were at World Championships. We were at World Championships, and this athlete had a emotional break. Uh, they mental health wise, uh, it was one of those things. So we and the athlete, because of that rapport, because of that relationship, the athlete came to me during their break. I'm not the mental health professional. That's not my job. So they came to me, and I was able to get them exactly where they needed to be so that they could be. And this was the day before they were supposed to compete at World Championships. And they have the break. Um, and we were also dealing with a very complex knee issue. That the thing was is that it was apparent that the athlete, there needed to be a surgical intervention on the knee. So the team, we get the athlete through the night. The athlete, it's a weight sport, so the athlete has to make weight. So we have to go through the drama of making weight. Remember, this athlete just had a mental break, right? They're in a fragile mental state. Their stress is high, right? Their weight cut hasn't been going well. So now we're in a point where we have to drop a couple of kilos, before weigh-in. So working with the nutritionist on that to make sure that the athlete is doing it in the safest way possible. Athlete makes weight. Get the athlete back in recovery, doing some work on the athlete's knee. The athlete's just tapped out. You can tell the athlete's tapped out. He was tapped out. But we are all staying positive. We are all there for the athlete. We are all devoted to the athlete, right? And I don't really know how to describe it, but to feel that on a team, to know that everybody there is devoted to this one person, it's a crazy feeling. Athletes in recovery, we get the athlete back in warm up. Athlete starts warming up for first attempt. Athlete is, I do like a final tape on the athlete. I do some cleanup work on the athlete, and athlete just smashes it at World Championships. Just kills it at World. I mean, just
awesome.
Knocks it out of the, and the thing is thinking about where the athlete was the night before, and where the athlete ended the competition, and to say that you were a part of the team that witnessed and experienced that, and all the while knowing everything that the athlete's facing, I mean, that is a testament to that athlete, right? And a testament to how dedicated the team was to the athlete. And afterwards, we had some issues with the knee. I'll just put it like that. The athlete ended up having to get surgery on the knee and everything like that. But the fact that we were all able to help the athlete keep it together, right? We focused enough on that athlete so that athlete was able to do what they needed to do to be where they were at the end of the competition. I think that that's probably, the memory that sticks out the most to me.
Yeah. That's got to be, just as good as holding up the Stanley Cup or something like that, having that kind of success. So that's awesome. Thank you for sharing that. So we'll go ahead and wrap up there. Thank you, Dr. Humphries, for helping us through this topic and sharing these personal stories with us. I've really enjoyed talking with you, and I think I'm sure our listeners have as well. Before we go, I'd like to remind you real quick about our resources section on ncmic.com. We're continually adding to our content with information to help doctors navigate daily practice and deal with challenges that you face. We have information out there on a wide variety of topics, including COVID issues and risk management, so please check that out. This webinar will be posted to the webinar section of the resource page. where you can also access recordings of past webinars that we've done as well. You can also keep up to date with on new resources from NCMIC by following us on Facebook, Twitter, Instagram, and LinkedIn. Finally, please mark your calendars for May 20th at 2 p.m. Central Time for our next webinar. We'll be sending out emails for registration on that. We're going to be talking with attorney Ken Skaz, who will be discussing legal issues and malpractice risks associated with electronic health records. So in closing, I'd like to thank everyone for joining us today. We hope the information presented has been helpful to you in your daily practice, and we hope that you can join us for our next webinar. Dr. Humphries, once again, thank you so much for joining us. We enjoyed it very much.
Thanks again for having me. Thank you again for having me. Have a great day.